Villa of Hope is here to help. Our Monroe County Department of Public Health is working diligently to reduce the chances of spreading the COVID-19 virus, and it's important we all follow those recommendations. That does not mean you cannot reach out for help. The Villa is here. We have people ready to take your call and get you the help you need. Whether you need general counseling, family support, MAT, or a compassionate ear, we are here. Call 1-833-993-HOPE.
Alexa, play WYSL. And hear the WYSL stations worldwide. WYSL1040.com.
Welcome back to the Villa of Hope radio show. Villa of Hope, rebuild, recover, renew. This is JC DeLass. We're so happy to have you along with us here. And in this segment, Saarah Waleed is with us. She's the Chief Program Officer at Villa of Hope. Been there for about 6 years now, right, Saarah? Tell us a little bit about your background and how you got with these good folks.
Thank you for having me. It's really exciting, this opportunity to speak a little bit about all the great, amazing work we're doing here. I've been at the Villa for 6 years, and my background and my training has been in mental health counseling. And when I started in the field about 20 years ago, I started with working with sexual assault victims and domestic violence victims, and very soon realized that in most of those cases, what the underlying factors were very much mental health and substance use disorders issues were going on. So very quickly, I changed my trajectory and went into the behavioral health field and has been, doing that work for a very long time until I started at the Villa about 6 years ago as their director of addiction services. So the program that I started was a really small 14-bed unit for young men dealing with substance use disorders, and it was a really intensive rehab program. Still, we have that program on our campus right now, and started to build from that and went into the clinic model, which already existed here. So we did have a small clinic with 2 clinicians in our clinic, and only serving our residential folks who lived on campus here. And as we started to look around and see the need in the community, in 2015 is when there was a study came out from Greater Rochester Health Foundation, which identified that young people in our community are waiting 8 to 12 weeks to get into any kind of treatment. And this treatment was mostly focused on mental health, but we all know that underlying factors in behavioral health are very much intermingled with substance use services as well as the mental health services. So we started to think about, okay, what can we do? We do have the expertise and we do have the infrastructure to do some of this work. We have psychiatrists on board. How can we help the community? And really the commitment here came from, focusing on providing substance use and mental health treatment in a manner that was readily accessible and people didn't have to wait very long. So that has, in the past 6 years, have been a huge focus of my role here. But since then, I'm also responsible for other programs on our campus, as well as in our community-based services. So my day-to-day really these days look a lot of strategy planning, operationalizing that strategy in the programs, identifying needs in our, community settings and where, the trends are for our behavioral health needs, responding to the opioid crisis within our programs, and really big focus on integration of all these areas because, as you know, we are dealing with human beings. You cannot separate out so many different things in human beings. We all want one-stop shop where we can really, take care and get help that we need. So that's my day-to-day.
It looks like your umbrella really covers a lot of different areas. I mean, you're talking about community-based programming, Hope Place, which we learned about a little bit earlier, residential, and then outpatient clinics, which is so important and really right now responding to a big-time community need.
That's correct. And, we started very early responding for the community need for COVID-19 before any other people, any of the other providers were looking into how the whole telepractice will work. And we really started, reaching out to our state agency and asking them what can we do differently. In the telepsychiatry world, the way things work on a state level is that you have to be licensed and you have to be under your particular clinic to be able to provide these services. And the states soon realized that this was not going to work. So we worked really hard along with all the state agency that are, licensed for us to provide substance use disorder services as well as mental health services to really work on some of the waivers that are needed to be able to provide these telepsychiatry services, which allowed us to use a lot of different mediums. So we are able to provide these services through phone calls, just pick up your phone and just call the old-fashioned way if you are challenged with video conferencing. So we have that option. We also were able to provide these services through video conferencing. So initially it was a lot of, focus on specific video platforms that we were supposed to use. But again, the states work really, really well with us and provided waivers to be able to do Skype sessions, to be able to do FaceTime sessions. Of course, we always have to be very careful that people know that all of these online, formats and phone formats come with some kind of a risk of violation of their privacy, perhaps, especially on their side, if they are, in the house and there are other people who are in the house with them, so they might not be able to have a private, conversation. So we just helped our clients and our staff to figure out a good way to create an environment which is private, which provides the best way to accommodate all the needs that technology needs, and still be able to connect with our clients.
Talking with Saarah Waleed, who is the Chief Program Officer at Villa of Hope. And, you just talked about the outpatient clinic still up and running during this COVID-19 isolation. And again, Saarah, it's so critical these services are available to people, maybe more critical now than ever before.
Absolutely, and we are seeing that, the reports from our other partners and providers that we work very closely with is that the spike in substance use disorders needs. As Christina, our CEO, talked about it, as we come out of this, there is going to be more and more need for mental health services and substance use disorder services. So what we have tried to do is really try to give services as seamlessly as possible. So we used to run groups for our folks who are getting services for addictions and are possibly using opioids and need services there. So in-person groups are very important because people get to talk to other people and normalize their struggle and find support there. And what we have done is moved all of our groups also to Zoom. So we give them, a key, it's a password. They come in and we monitor that, nobody's who's not part of the group can add to the group. And then they're still being able to get support from each other. So we have tried to, keep these services going in spite of all of these restrictions. But we also have in-person presence for our services in the clinic. So our clinic building is still operational every weekday from 8 to 4 o'clock, so people can still come in, but we are doing those services telepsychiatry. So what happens is that if somebody comes in and they possibly don't have a phone or they don't have access to internet and they still want to have this session, we do have the ability to provide them a space in our clinic where they can sit, and we will provide them with a phone or a computer where in the next room their therapist can still do that session. It's still we are practicing social distancing. We are practicing all of the precautions that we need so that we are not in person doing this counseling, but at the same time not distancing, on that level.
Well, and it sounds like that phone number that we had earlier, 1-833-933-HOPE, that really is a great first step, isn't it? Because if people call that number, you can kind of steer them into the right direction to get the help that they need.
Absolutely. That number will get you connected with the right services. We have our staff who are very skilled in figuring out, even if you don't know where to start, and just call that number and talk to someone, and they will triage that call to the right person, and you will get the call back, and we'll get you in. We are open. We are taking new clients. We are doing intakes. We are providing medication-assisted therapies. All of those services are active and running.
We're talking with Saarah Waleed, who is the Chief Program Officer at Villa of Hope. And Saarah, I want to talk a little bit more about this concept of combining treatment for mental health and substance abuse. And you talked about that a little bit, but I'd like to go maybe even deeper into it, because I really think that's an important thing for people to learn more about right now. Because as you said, especially with the isolation that we're going through and the difficult times that we're in, where the people are having financial difficulties or all the other things that are happening, mental health and substance abuse, unfortunately, really end up going hand in hand right now. And you guys have a way to help people in that time.
Absolutely. You're so right. They do go hand in hand. And even before the COVID-19 emergency, we would always see people who are coming in for either mental health directly or just for substance use disorders. Very soon, as you start the conversation, those two intermingle, because for a lot of people, addiction is part of an escape, part of, treating the underlying trauma that they might have suffered, maybe as a child, maybe as an adult, we don't know. And as you start to, peel back the layers, you realize that this is all interrelated and you cannot treat one with the other. And historical models have been where you have a mental health therapist and then you have an addictions therapist, and they don't talk to each other. And those models have really shown us that they are not very helpful to our people who need help, and also looking at it as a spectrum of wellness. So we all have different, challenges in different times in our lives, and instead of looking at there is this illness involved and we need some intensive treatment, we have to normalize the concept of wellness and start to treat people on different areas in that spectrum. That the mental health needs and substance use needs don't just go away. You might be in a remission, you might be in, just like in a medical condition, you might be in a relapse mode or in a remission mode, and that applies to both mental health and substance use disorder. And we have to start looking at it at a holistic manner, and that is the best way to fight the stigma that comes with sometimes addictions and mental health. And in our program, when you come in, you do not have to identify what your real needs are. Our therapists, our intake coordinators sit with you and really lay it out, and wherever that fits. If one of the goals is to maybe stop drinking or even reduce your drinking, that's what we will focus on. And if we really make it very person-centered and true harm reduction, so the judgment is not there. We want to work with you, and if your family's involved, with them, to really look at what are your needs and set small goals which you can feel good about achieving and working towards, and take the judgment out.
I really think that's interesting. You used the phrase, I think it was holistic approach, in that you're really talking about physical and mental well-being, the combination of the two and how they work together, and how you really can't solve one problem and then leave the other one go. In other words, you have to really fix both the physical and mental well-being to get people to where they want to be. And I think that's where this integrated clinic, the behavioral health, mental health, and addiction services program that you have there at Villa of Hope, I think that's really where that's going to pay off down, not only now, but especially here in the future.
You're absolutely right, and that we strive for right at the time that we meet with our clients, to really understand what their needs are and really customize all of our services accordingly. We collaborate with other providers within our agency and outside to make sure that we meet the client where they are and how they need to be met. And
I think, Saarah, too, pharmaceuticals as they are in this community, I think it's fair to say people are prescribed so much medicine. Some might say overprescribed. I'm sure you guys look at it as, hey, let's see if we can figure these things out without going the pharmaceutical route, if we can.
So, yes, so that really would depend, right? So when we get our referrals, some people are coming in already on medication. Mm-hmm. So for them, it is really important for them to understand what that medication is for, what are the various, interactions with some other things that they might be using or doing. So a lot of patient education, client education also takes place for some people who have been in there. And for people who have not ever tried medication, we want to give people good information on what are the things that are available for them before they take medication, or even if they decide that they do want to take medication. So there's a lot of patient education, again, in a spirit of very person-centered, holistic, and integrated manner. That is the foundation that our clinic stands on in really giving people choice and informed choice, so that they can learn what their needs are and then make a decision. And we are there every step of the way helping them make that decision.
Yeah, really interesting stuff. Saarah Waleed, who is the Chief Program Officer at Villa of Hope. And a couple of minutes left in this segment, Saarah. And I always ask everybody this same question about the priorities coming up. And it sounds like you're so busy, your priorities really are right there in front of you in terms of the things that you're trying to achieve. But I also know you have some long-term goals, too.
Absolutely. And our long-term goals, one of the next steps that I know Christina had mentioned in her segment was where we are going in the future. As you know, the needs here are tremendous, so we continue to expand. We continue to see our need increase. Our intake numbers grow, and one of the projects under this clinic is to have another site for this clinic. Currently, we are located on J Street, and we received a grant from the Office of Mental Health, and we are able to actually do a capital project and redo a building that exists on our 3300 Dewey Ave campus, and we are building a new clinic there, and that will also be an integrated clinic, so we will have two sites then for our community to be able to participate in mental health treatment.
And that new clinic, how many more patients will you be able to see? I mean, that really is going to expand the opportunity for services.
Absolutely. That will also serve our folks here in residential treatment and their families as well. So currently at any given, currently our enrolled folks are around 900 people are enrolled in our clinic. So this will at least double the capacity. But again, a lot of our services are also in home and community-based. So some of our therapists are actually going into schools and as well as going into people's homes to do that service. But that will definitely expand our capacity.
Terrific stuff. Saarah, we really appreciate you being with us to tell us more about what's happening with these special programs at Villa of Hope. Continued success. Keep doing what you're doing. It's very important. And again, we really appreciate your time.
Thank you so much.
Saarah Waleed, the Chief Program Officer at Villa of Hope, joining us. We're going to take a final break, and when we come back, we'll wrap this up and also get you ready for our next program coming up next month as well, the Villa of Hope radio show right here on the WYSL stations.
For over 75 years, Villa of Hope has risen to meet the changing needs of our community. Caring staff at the Villa know trauma and how it can change your life. As we face personal challenges, the Villa stands as a place where individuals, youth, and families can rebuild relationships, recover potential, and renew hope for the future. For more information, visit villaofhope.org or call 1-833-993-HOPE.
You're listening to Villa of Hope Radio on the WYSL stations.
Villa of Hope is here for you. Adults, youth, parents, grandparents, no matter who you are, we are here to respond to you and make connections to the services you need right now. How that help looks may be different from before, but we are committed to making sure we are giving you our best while keeping everyone as safe as possible. Let us help rebuild your resilience. Call 1-877-584-HOPE. That's 1-833-993-HOPE.
The one media outlet you can count on. The voice of liberty. The WYSL stations.
Welcome back to Villa of Hope Radio Show. Villa of Hope, rebuild, recover, renew. This is J.C. DeLass. Hope you had an interesting time here during this hour talking to Christina Gullo, the president and CEO of Villa of Hope, Megan O'Donnell, the director of community-based programming, and Saarah Waleed, the chief program officer. Again, learning more about all the great things that are happening at Villa of Hope. As the only sanctuary certified agency in the Finger Lakes area, Villa of Hope is an expert in trauma-informed care and how trauma can shrink the brain. So we're going to learn more about that in our next program, talk about how trauma and structural racism are affecting the youth, families, and individuals right here in our community. And again, we're going to learn more about that in our next program. The fresh one will be coming up Thursday, May 28th at 6:30, so make sure you tune in. This is J.C. DeLass. Thanks so much for joining us here, the Villa of Hope Radio Show on the WYSL stations.
Thanks for listening to Villa of Hope Radio on the WYSL stations. Find out more at villaofhope.org.